Hello and welcome to ABC News. I'm Ros Childs. A new variant of coronavirus has been detected in Melbourne as Victorian health officials confirm 4 new locally acquired cases have been recorded in the past day. Let's go straight to reporter Stephanie Ferrier, who is in Melbourne. Hi, Steph. What can you tell us about this new variant?
Yes, good afternoon, Ros. Well, these new 4 cases all have been genomically linked to this Delta variant, which is known as one of the most infectious variants that has currently become infamous across India and also parts of the UK as well. The new 4 cases relate to 3 members of the same family that have had this Indian variant, and that is 2 parents and a child, and it's believed that a second child as well could also test positive in the coming hours. The 4th case is unrelated and is linked to the rest of the cluster, but what we do know is that this family, it's understood, had a grade 5 who also must have come in contact with the grade 5 from the family from West Melbourne that had travelled up to New South Wales. Now, so this whole family cluster, if you like, the travellers that went up to New South Wales and came back, which is now at 7 cases, they all have this Delta variant, and Brett Sutton, our State's Chief Health Officer, is saying that they are now going to have to try to work out exactly where it came from, because it is just unknown and we haven't seen it out in the community as yet. So they're going to be working not just through all of the upstream contact tracing within this state, but also with New South Wales, ACT and Commonwealth officials as well. And they'll also be looking at potential maritime, aviation and even diplomatic effects, just to see whether or not there's any link and where this could have possibly come from. Let's have a listen to what Brett Sutton had to say.
That variant is the Delta variant, so it's the B1617.2 variant that is now infamous in India and increasingly in the United Kingdom. It is a variant of significant concern. It has not been linked to any sequence cases across Australia from hotel quarantine or anywhere else.
Now, he does say that it appears to be the most significant strain we've seen so far in terms of transmissibility, as well as information about the severity of this illness being particularly worse in children, and also the increased transmissibility in children as well, which is a real concern because, of course, we've got around 300 people that are currently in quarantine from that North Melbourne primary school.
So potentially then, what could this mean for the length of the lockdown there in Melbourne, which is entering its 2nd week?
Yes, well, this is a bit of an issue because Brett Sutton said that it is a disturbing development. However, he has been pleased to see 2 of the previously positive cases removed from the books. These were 2 false positives involving a person who had travelled to a display home in Melbourne's north, and also a man who had been at a Brighton Beach hotel outdoors and in well ventilated. They got their word that they are now negative, and so all of their close contacts have been released. Now, there's been a lot of questions about this as well, as to whether or not they overplayed their hand calling this other strain, the second Indian strain, and not as infectious as Delta that we now have, calling that a beast and words like that. However, Jerome Weimar, who is the state's testing commander, says that there are still 8 other cases that could have come about as a result of this so-called fleeting contact, where people have not had very much contact and didn't even know each other. And they are looking particularly at 5 exposure sites of concern as well. So that really hasn't made too much of a difference. Let's have a listen to what he had to say in regards to these 2 false positives.
Is there hard evidence? Absolutely. We've got 8 people with COVID recovering at the moment. It's very different to the previous cases we've seen here, and certainly here in Victoria. Over the last year, it is operating in a different way. We did not make a decision about where we were with the entire outbreak based on these 2 cases alone.
So there you go. That's Jerome Weimar saying that it really was immaterial, these 2 false positives, in terms of the length of the lockdown. This new Delta strain is of particular concern, and it seems as if we might be still in lockdown until Friday next week. And of course, what's even more important is the QR code compliance now. As of this morning, that is compulsory and mandatory for everybody to check in, even if you're just grabbing a cup of coffee for under 15 minutes. And there will be fines for businesses if people fail to comply of up to $1,600.
Steph, thank you.